As a general rule, just leave the COVID-19 out. If you are a cardiologist or any healthcare professional, as a matter of fact, if you go to work in a busy job, yes, you can get burnt out. So it's very important that you balance your work and your personal family life to keep yourself, um, you know, uh, away from work for some time so that you don't get burnt out. It's very important. I think you have to strike a balance, and it's very easy to, especially when you're young and you have energy just to work, 12, 13, 14 hours a day, and get burnt out over, because what we are is, we have to think this is like a marathon. Your cardiology career, or your any career, as a matter of fact, is a marathon, not a sprint. So it's very easy to sprint, and then you realize that you can't complete your career, or your rest of the career. I think it's very important. Now, COVID-19, of course, has added more or a different dimension to it. So, for example, as a cardiologist, we are now working in a shift system. So we are working 4 days in and 4 days off. And we work 12-hour shift in the 4 days, and then we get 4 days off. So where we try and relax and, mentally and physically, and then come back more fresh. I think that approach is probably an excellent way. But then over time, what will happen is there'll be less doctors on the ground, because they'll be pulled off. For example, we have something called Nightingale Hospital, which is being used in NEC in Birmingham, where some of our doctors will be taken. So which means we will feel the pressure on the ground in the hospital setting. Yes, it can happen, but the best way to balance is you have to support your colleagues, you have to work in a team, and maybe in a shift system, and cutting down all the elective activities, because that's why we've done. We have cut down the elective activities so that we are not busy from that front, so that we can focus on COVID-19 situation. No one knows how long this is going to last for, but my advice for cardiologists is to strike a balance. And I'm not speaking just for cardiologists, for everyone. In fact, I've got more worries for the nurses and the frontline physician who deal with these patients, day in, day out. They're more vulnerable than us, and I've got more respect for them. So they have to probably, take turns, work in a shift system, have enough time for relaxation. It's very important.